This conference will now be recorded.
Hello everyone, I am Dr. Juma Vishas, one of the specialty doctor in UK, and today I am going to discuss one of the recent talk. It's April talk 21, that is breastfeeding and drugs. And you know that many women choose to breastfeed their infant, and most drugs can be taken safely by the lactating mother, and most commonly medications we are using during breastfeeding, that's paracetamol, and most of the antibiotics and inhaler are considered safe for women to use during lactation. And this is a common chart that is where it's very nicely explained which drug is preferred and which drugs we can avoid during breastfeeding. Like in case of analgesics, preferred drugs are paracetamol, ibuprofen, and dihydrocodine, and we have to avoid codeine phosphate. Regarding antibiotics, coamoxiclav, flucloxacillin, metronidazole, and ciprofloxacin for short-term use is a preferred options, and we have to avoid nitrofurantoin in babies with glucose 6-phosphate dehydrogenase deficiency or less than 8 days old. Regarding antidepressant, sertraline is the preferred drugs. Regarding antihypertensive, enalapril, nifedipine, or all other calcium channel blocker is the first line medications. And if we need further medications, we can add labetalol, beta blockers such as atenolol. Other than this, like other than enalapril, all other ACE inhibitors, diuretics, and angiotensin receptor blockers should be avoided in pregnancy. Regarding anti-epileptic drugs, all are considered safe. Only phenobarbital and primidone should be avoided during lactation. Regarding contraceptions, all the methods of contraceptions usually safe in breastfeeding, but only the ulipristal acetate, if we give to the mother as an emergency contraceptions, we have to tell them that they should avoid breastfeeding for 7 days. So let's talk about in details of all the medications. So firstly, we will discuss about analgesics. So as you know, in postpartum period, we are commonly use the medication are analgesics, and we commonly use paracetamol. It's a non-opioid analgesics with no anti-inflammatory actions, and its peak level reach in breast milk approximately 1 to 2 hours after injections. However, evidence shows that it's completely safe in breastfeeding. Next is ibuprofen. It's an NSAID, and it also shows that there's no effect on breastfeeding and also to the baby. So it is also completely safe in breastfeeding, and these two are preferred analgesics during if the mother is lactating. Regarding codeine, codeine is metabolized to morphine, so that's why there's some evidence shows some fatal case of morphine toxicity in breastfeed infant. And that's why in MHRA and in EMA, that is European Medicine Agency, contraindicated is used in breastfeeding women. And it also shows that maternal codeine has associated with uh, asymptomatic bradycardia, apnea, and cyanosis in infants. So that's why codeine shouldn't be used if mother is lactating. Regarding dihydrocodine, though it's also metabolized in dihydromorphine, but it's very smaller quantities. So UKMI, that is UK Medicine Information, support the use of dihydrocodone in breastfeeding women at a lowest dose for in shortest duration. Others like aspirin. Aspirin can cause raised symptoms if you give it to the infant for viral infections, though its association with breast milk is very unknown, but there's some report shows that thrombocytopenia, fever, and petechiae can cause to a 5-month-old breastfed infant after her mother took aspirin for a fever over 5 days. That's why aspirin is not a pain relief of choice during breastfeeding and it should be avoided. But occasionally, low dose of aspirin would not be expected to increase risk to a breastfeeding infant because only smaller amounts are known to be detectable in breastfeeding. So if we need to use aspirin, that should be lowest dose, that is 75 to 300 milligram daily. Regarding therapeutic use of morphine as an postoperative analgesia are unlikely to be harmful to the infant in the short term, so it is recommended it's to observe infant for sedation and poor feeding. So we can use morphine for a shorter period of time, but it's important to observe infant for sedation and poor feeding. So this is all about analgesics. Let's talk about antibiotics. So this is the second drugs we commonly use in postpartum period. And you can see that coamoxiclav we commonly use during following C-sections, following instrumental delivery, following third degree or fourth degree perineal tear. So it's considered safest broad-spectrum antibiotic for use in context of breastfeeding. Flucloxacillin is also considered as safe. Metronidazole, according to American Academy of Pediatrics, it's recommended that withholding breastfeeding for 12 to 24 hours after single dose administrations because of concern of regarding metronidazole associated carcinogenesis and mutagenesis in vitro. However, this is not the case in UK, and here we can use metronidazole in a lactating woman. Regarding ciprofloxacin, it shouldn't be used if mother is lactating because of concern regarding effect on developing joints. Tetracycline also contraindicated during breastfeeding because it can cause staining of infant's teeth or bone deposition of tetracycline. Nitrofurantoin is considered contraindicated to use directly in infant under 1 month old or in those with glucose 6-phosphate dehydrogenase deficiency because it can increase risk of hemolysis. Vancomycin and teicoplanin considered as safe during breastfeeding. If any woman needs any antidepressant, so the sertraline is the drug of choice, but fluoxetine, there's some report shows that it can cause colic and drowsiness in a smaller number of infants, but it is not recommended to stop fluoxetine for breastfeeding if it is required by the mother. And the use of tetracycline outside of pregnancy, relatively low level required for overdose, can make other medication preferable. So we can use tetracycline in a lowest dose. Sorry, TC antidepressant in a lowest dose. Regarding antihypertensive drugs, first-line medications are enalapril and nifedipine for women of Black, African, or Caribbean family, as because there's no adverse effect shows or reported in infant exposed to that. But if any woman have any uncontrolled blood pressures like more than 150 and 100, we can be managed in combinations of nifedipine and enalapril. And we can also add or swapping atenolol or labetalol to this combination is also appropriate if like nifedipine or enalapril proves ineffective or if it is not tolerated. When treating hypertension in breastfeeding women, ONS daily regimen should be used when possible. So regarding antihypertensive, the first line medication is enalapril and nifedipine. If it is very high blood pressure, we can use in a combinations of both of these, or if it is not tolerated by patients or if it is not controlled by combination of that, we can swap it to atenolol or labetalol because these are also safest one. Regarding VT and breastfeeding, all the thromboprophylaxis considered as unsafe. Warfarin excreted in breast milk very low level, so it is considered as unsafe. Enoxaparin, it's a low molecular weight heparin as it's a very large molecular weight like 2000 to 8000 Dalton. So it's excreted into the breast milk. So it is also considered as safe. However, Direct oral anticoagulants are not currently recommended as a first-line treatment for venous thromboembolism in pregnant or breastfeeding women because there is a paucity of safety data. So we can use warfarin and also low molecular weight heparin in lactating women. Regarding asthma, beta-2 agonist is the safest inhaler we can use. Montelukast excreted in very low level in breast milk, so it's also considered as unsafe. And if we need to use steroids, it's shown that prednisolone up to 40 milligram, it's safest. We can use if mother is lactating, as because it's extensively bound to plasma protein and it is very poorly excreted into breast milk. So up to 40 milligram per day, we can use if mother is lactating. And commonly used monoclonal antibodies like adalimumab or if infliximab are also shown safe in lactating mother. In anti-epileptic drugs, levetiracetam excreted in very low level in breast milk and it also considered as safe during breastfeeding. Lamotrigine also considered safe, but the thing is that infant have a serum concentration that reflect the maternal serum and milk lamotrigine concentration. So therefore, we have to monitor serum level, and according to that, we have to adjust the dose of lamotrigine. And in contrast to pregnancy, sodium valproate also reassuring safety profile, and it can be recommended during breastfeeding. So lastly, regarding contraceptions, like levonorgestrel containing emergency pill are safe, but if any woman wish to take ulipristal acetate, we have to inform her that she should avoid breastfeeding for 1 week. And the most commonly method, that's lactational amenorrheic method, you know that it's 90%, 98% effective if they meet the criteria, like if mother is exclusively breastfeeding for 6 months and if she's amenorrheic, so it can give protection for like about 98%. So in other circumstances, contraception is required from 21 days postpartum period, and progesterone only pill and contraception injections are safe for breastfeeding women. From 6 weeks postpartum, breastfeeding women are eligible to use for combined pill contraceptive patches. But any woman wish to use copper IUD or Mirena, they can be used or they can be fitted within 48 hours of giving birth. So that's all about breastfeeding and drugs. I hope you enjoy this video. And if you have any queries or if you want to know about our courses, you can text us in WhatsApp. These are our WhatsApp number. Thank you. Thank you for listening.